Hello friends, today let's talk about the definition, scope of therapeutic exercises. Let's start with the introduction. Therapeutic exercise is a key component of any rehabilitation program and should be included as part of the concurrent care of any patient. Physical therapists have been utilizing therapeutic exercise with great success since the conception of the profession in the beginning of 20th century. And it has been demonstrated to the fundamental in improving functions, performance and disability. Therapeutic exercise can consist of a variety of exercise inclusive of balance, strengthening, range of motion, endurance, and plyometric activities. DLETO defines therapeutic exercise as bodily movement prescribed to correct impairment, improve musculoskeletal function, or maintain a state of well-being. It may vary from highly selected activities restricted to specific muscles or part of the body, to general and vigorous activities that can return a convalescing patient to the peak of physical condition. Here comes the objective of therapeutic exercises. Quality patient care involves a problem-solving process whereby the therapist makes effective decisions based on symptoms, signs, limitations identified with evaluating and re-evaluating the patient. A comprehensive evaluation of the patient not only avoids the pitfall of overlooking some important contributing factor and allow for defining the functional limitation of the patient, but also influence important decisions regarding the development of the treatment program. Some of the objectives of the therapeutic exercises are assessment, develop a plan, implement the plan, evaluate the plan, and home program. First, coming to the assessment. The first step is to assess the need of the patient. To provide cost-effective quality care in today's healthcare environment, it is critical to measure needs in terms of patient's impairment as well as any function limitation and resulting disability or handicaps. The examination and assessment of the result provides the foundation for establishing a baseline from which outcomes of the therapeutic intervention can be measured. The assessment can be subjective information or it can be the objective data of the patient. Here comes the subjective information, that is case history. Ask question so that the patient will describe the onset of symptom or mechanism of injury, describe how the symptoms are perceived, describe the behavior of the symptoms through 24-hour period while carrying out typical daily activities, describe any previous history of condition, find out if there was previous treatment for the problem, describe related history such as medical or surgical intervention, identify any medical condition that may contraindicate to any testing procedure. Next comes the objective data, that is clinical evaluation. First, start with the inspection. Make observation of appearance and basic abilities such as use of any adaptive or supportive aids, general posture and specific posture or shape of involved body part such as contour changes, swelling, atrophy, hypertrophy and asymmetry, appearance of skin such as scar and discoloration. Next is hitting and gait pattern, coordination and balance. And next come with the provocation. Use the principle of selective tension by administering specific tests in a systemic manner to provoke or recreate the symptom and thus determine whether the lesion is within an inner structure, joint capsule, ligament, bursa, fascia, or a contractile unit, muscle with its tendon and attachment. And next is the palpation. Palpate the structure that are incriminated as the source of the problem. Next is the neurological test. Any indication of motor weakness or change in sensation directs the evaluator to specify tests to determine nerve roots or central nervous system involvement. And fifth one is additional tests. Special tests unique to the specific tissue in each region are carried out if necessary to confirm or rule out the structure in question. And next one is the develop a plan. After evaluating and assessing the patient's need, the next step in the clinical decision-making process is to establish a goal and appropriate plan. Here comes established goal for expected functional outcome. They are related to how treatment will affect the functional limitation or disability at the conclusion of the therapeutic program. Each goal should be measurable and specified to the condition. And next is the develop a plan of care. In this, determine what therapeutic approach will most appropriately meet the goal. Consider resources available to the patient situation. And next, select the technique or therapeutic modalities that will fulfill the plan or meet the goal, and determine what mode of evaluation will be used to document the change reflected in the goal, and anticipate the length of the treatment and plan for discharge. Consider any alternate service for treatment. And next objective is implementation of the plan. Once the plan of care is established, use procedure and techniques that will fulfill the plan and meet the goal. Involve the patient in the management of the impairment both in a home exercise program as well in the adaptation or modification of the home, work or recreational environment to minimize or eliminate precipitating factor contributing to the problem. Next objective is the evaluating the plan. Frequently evaluate and reassess the effectiveness of the procedure and techniques and modify them or the treatment plan whenever indicated. And next objective is home program. A home program should be viewed as an extension of the treatment plan of care. Early identification of the patient home or alternate care setting, family recreation, social and economic capabilities, equipment needed and vocational plan provide a foundation for anticipating compliance with the home exercise program. If necessary, identify who could and would work with the patient at home. Scope of therapeutic exercises. Following a comprehensive evaluation of the patient and identification of impairment, functional and limitation disabilities, the goal of treatment and functional outcomes are developed and the plan of care, that is the treatment plan, is established. The scope of therapeutic exercise includes the prevention of dysfunction as well the development, improvement, restoration or maintenance of number 1, strength, number 2, endurance and cardiovascular fitness, number 3, mobility and flexibility, number 4, stability, 5, relaxation, 6, coordination, balance and functional skills. First, strength. A major goal that can be achieved through the therapeutic exercise is the development, enhancement or maintenance of muscle strength. Strength is the ability of a muscle or muscle group to produce tension and the resulting force during a maximal effort, either dynamically or statically, in relation to the demand placed upon. Guideline for developing strength. The overload principle. To increase strength, a load that exceeds the metabolic capacity of the muscle must be used during exercise. This will lead to hypertrophy and recruitment, and therefore to an increase in strength of the muscle. The capacity of a muscle to produce greater tension can be achieved primarily with high-intensity exercise, such as exercise performed against heavy load, carried out for a relatively low number of repetitions. In both cases, the muscle must be exercised to the point of fatigue for adaptive increase in strength to occur. And next is endurance and cardiovascular fitness. Muscular endurance or total body endurance can also be improved or maintained with therapeutic exercise. Endurance is necessary for performing repeated motor tasks in daily living and carrying out on a sustained level of functional activity, such as walking and climbing stairs. Here comes the types of endurance. First one is muscle endurance, and second one is general or total body endurance. First, coming with the muscular endurance, the ability of a muscle to contract repeatedly or generate tension, sustain the tension and resist fatigue over a prolonged period of time. As endurance increases, a muscle will be able to perform a greater number of contractions or hold against a load over an extended time. And second one is general or total body endurance. The ability of an individual to sustain low-intensity exercise, such as walking, jogging, or climbing over an extended period. Endurance exercise, also called aerobic exercise or conditioning, is performed to enhance the cardiovascular or pulmonary fitness of an individual. Here comes the guideline for developing endurance. First one, muscular endurance. Active exercise performed repeatedly against a moderate load to the point of fatigue will increase the endurance of a muscle. And second one, general endurance. Exercises that challenge the oxygen transport system will increase endurance, aerobic capacity, and overall cardiopulmonary fitness. Exercise is usually directed to large muscle group, as in walking, running, swimming, and cycling. And exercise is prolonged and performed for 15 to 45 minutes or more. And the frequency of exercise varies. For example, exercise every 5 days or 5 days a week. And the next comes the mobility and flexibility. In addition to strength and endurance, the mobility of contractile soft tissue and joint is necessary for the performance of normal functional movement. If normal motion of body part is restricted in any way, adaptive shortening of the soft tissue and joint will occur. Tightness should be prevented if possible, but if tightness does occur, mobility exercise may be used to restore the involved structure to their appropriate length. Soft tissue refers to contractile and non-contractile tissue, that is, muscle, connective tissue, and skin. Each structure should take in consideration the normal functional activity. Here comes the guideline for developing mobility. First is the passive stretching. Manual, mechanical, or positional stretches are applied to soft tissue in which the force is applied to the direction of shortening. Second one is active inhibition, reflex inhibition and subsequent elongation of muscle using neurological principle to reduce tension and lengthen the contractile element within muscle. And third one is flexibility exercise. Exercises are performed by the patient passively or actively to elongate soft tissue. And here comes the joint mobilization. Passive traction or gliding movement are applied to joint surface to increase the joint mobility. And next one is stability. Stability refers to the synergic coordination of the neuromuscular system to provide a stable base for superimposed functional or activities. Stability is usually required more in proximal structure such as trunk, hip, and shoulder girdle for effective positioning and motion of the arm and hand or leg and feet. And here comes the guideline for developing stability. Stability exercises are the means by which a patient can learn to control proximal area of the body and maintain a stable, well-aligned position while carrying out functional activity. And closed-chain weight-bearing activities using graduated comprehensive load stimulated co-contraction in antagonist muscle group, that is opposite to prime mover muscles. And next is stabilization exercise are progressed by performing controlled diagonal motion while maintaining proximal stability. And next is endurance in stabilizing muscles must be developed with repetitive controlled stretch. Next is component of functional activities, and finally entire functional activities are practiced using appropriate proximal stabilization. Next is the relaxation. Prolonged muscle tension can cause pain, which leads to muscle spasm, which cause more pain. Relaxation refers to a conscious effort to relieve tension in muscle. Through therapeutic exercise, an individual can become aware of prolonged muscle tension and can be taught to control or inhibit it. Next is therapeutic basis of relaxation exercise. After an active contraction of skeletal muscle, a reflex relaxation occurs. Stronger the contraction, the greater the relaxation of that muscles. Conscious thought can also affect tension in the muscle. This has been demonstrated in biofeedback. And here comes the guideline for developing relaxation. The patient is placed in a comfortable position with all body parts well supported. The patient is taught to progressively contract and relax the musculature. And next is the coordination, balance, and functional skills. Coordination, balance, and functional skills are all interrelated and are complex aspects of motor control. Coordination refers to the ability to use the right muscles at the right time with appropriate sequence and intensity. Balance refers to the ability to maintain the center of gravity over the base of support, usually while in upright position. Functional skills refers to the varied motor skill necessary to function independently in all aspects of daily living. Coordination, balance, and functional motor skills are all dependent upon and affected by the sensory system, particularly the somatosensory and proprioceptives. Here comes general principle of exercise to develop coordination, balance, and functional motor skills. First, learning and relearning functional motor tasks involves constant repetition of simple to more complex motor activities. Movement can be initially practiced in simple form and then carried out using combined or diagonal movement. Proximal stability is often emphasized before distal mobility. As the quality of movement improves, the speed and timing of movement should be improved simultaneously. And here comes the conclusion. An important factor that influences the effectiveness of any therapeutic exercise program is patient education and active involvement in a systematic plan of care. Long-term functional improvement and prevention of future injury will occur only if the patient understands the goal of an exercise plan and incorporate the advice and instruction of the therapist into all aspects of daily living routines. That's all. Thank you.